Hello everyone, welcome back to the channel. My name is Dr. Cameron Marshall. I'm a concussion researcher and founder of the world's largest concussion care network, Complete Concussions, as well as the Concussion Fix program. I've dedicated my life to helping people to recover from persistent concussion symptoms, and today we're talking about a big one, brain fog. Now, this presentation was originally recorded as part of our Concussion Fix member series, where we host in-depth workshops every couple of weeks to dig into specific recovery topics for our members. These sessions are a bonus for members inside the Concussion Fix program, but I wanted to share this video on YouTube for a broader audience because it is such a problem for so many people dealing with persistent symptoms. Now, if you find this video helpful, make sure to like, subscribe, and share it with anyone you know who's dealing with persistent concussion symptoms. Also, check out the description below this video because I've included a bunch of helpful links and free resources to help support your recovery, including a link to our free weekly live workshops for concussion patients, where we teach you how to use the latest science to support your recovery, all from your own home. There's no expensive treatments required for concussion. You just need the right plan and the right strategy. Number 2, we've included a link to the Concussion Fix 2.0 program, which is our step-by-step online recovery system. It includes expert support from me and our clinical team, plus access to a private community of over 1,000 people who actually get it, because recovery is better when you're not doing it alone. And finally, you can grab our free Conquering Brain Fog guidebook. It's 21 pages of research-backed strategies to help you get clarity and energy back into your life and get rid of that brain fog. So the links for that are all in the description. And all right, let's get into it. I hope you enjoy the video.
Hello, hello. Happy Thursday. All right, everybody is in. This week is not Q&A. I know last week we had a presentation also. I actually presented as Dr. Marshall and Melinda were both on vacation, so we kind of had to switch up this 4-week rotation. But this is the normal week for a seminar. So Dr. Marshall is presenting today, and he is presenting on brain fog, which is, I think, a symptom that almost every member that I've ever spoken to has. So I think it will be great to kind of dive deep into this. So I will turn it over to you, Dr. Marshall.
Thank you. Hello, everyone. Well, okay, my microphone. Is it still good? Can you still hear me?
Yeah.
Okay. I just got a message about my microphone. Yeah, so today we're talking about brain fog. I hope everyone is enjoying the new Concussion Fix 2.0. I think it's awesome. We spent a lot of time and effort going through to try and make it as comprehensive, but also as bite-sized as we could. So hopefully people are enjoying that. All right, brain fog. So here's what we're going to talk about today. We are going to go into these kind of main areas. Obviously, like, what is brain fog? It means different things to different people, so it can be a little bit subjective in that way. And then we'll talk about the causes and then how do we go about fixing it. So first off, brain fog, like I said, is subjective. It's different things for different people, and people will describe it in the following ways, right? Some people might describe brain fog as confusion, forgetfulness, a lack of focus or concentration, difficulty thinking clearly, slowed thought processing, difficulty with word finding, or feeling sluggish, low energy, or mental exhaustion. Am I missing any there? Does anyone want to put in something that is not on that list that they think should be? You can just type it in the chat and I'll read it out. No takers? Strange vision. Okay. Head pressure, heavy head feeling, tunnel vision, shrunken perception, head filled with cotton, trouble thinking clearly, slower movement. It's interesting that it can mean so many different things to different people. Right? So when people talk about brain fog, it's really difficult to understand exactly what they mean. And so I'm going to cover this on kind of a more general idea around kind of cognitive functioning. A lot of people will talk about visual symptoms as being brain fog. Like if they have a bit of blurry vision, they might call it brain fog, or like perceptual difficulties with visual, type symptoms. They might call that brain fog. Those are mostly kind of more on the visual side. Sorry, phone call coming in. Um, but we'll cover it kind of from a cognitive perspective. So we think about cognitive function, and we do cover this in the new program as well. But the biggest predictor of cognitive complaints is actually on the mental health side. So things like stress, anxiety, depression, PTSD, they are the highest correlates of PCS patients reporting cognitive difficulties. So if difficulties with processing, with memory, with kind of feeling like your head is filled with cotton and you can't think clearly, and all of these types of symptoms that people talk about, the number one kind of association is actually on stress, anxiety, depression, PTSD. And I'll show you a lot of research on that point. But there's a whole bunch of other factors. Physical pain, right? If you're in pain or if you have a constant headache, it's pretty hard to feel mentally clear. You're going to feel kind of foggy and you can't think straight because you're dealing with pain. And that just makes cognitive processing more difficult. Autonomic function, right? If you're stuck in fight or flight, and this kind of relates to this anxiety, and I'll kind of show you a bit of a flow chart in a minute here, that autonomic dysfunction causes cerebral blood flow issues. So your brain doesn't get enough blood flow, or it gets altered blood flow, and therefore your brain doesn't work as well. And so you're going to feel cognitively slow, sluggish. You can't think clearly. But that's also really tied to anxiety, and it takes you into this kind of rumination phase. Inflammation, same thing. If your brain is inflamed, you're not going to be able to think and process information properly. And you're also going to feel slow, foggy, sluggish, all of these types of symptoms. Energy metabolism kind of fits with neuroinflammation. Sleep is how we clear inflammation. If you don't have a good night's sleep, you're going to feel foggy. And a lot of times after concussion, our sleep is disrupted. It's dysregulated. We're not getting good quality deep sleep. And this is also tied to autonomic function. It's hard to get into a deep sleep phase when we're stuck in fight flight and also potentially have, anxiety around sleep. It makes it difficult to sleep, and therefore we're not going to clear the inflammation. We're going to have poor energy metabolism. So you can see how all these things fit together. And then finally on this list is medications. Now there's probably way more in this bucket, but this is just kind of a small list here. Medications, a lot of medications that people might be taking can impact cognitive function. So the drivers of PCS and how they relate to cognitive function, right? Remember, we have the 5 kind of main causes of PCS. And number 1 is autonomic dysregulation. We talked about that as a potential driver, right? It's going to affect your cerebral blood flow. Your blood flow is tightly regulated through your autonomic nervous system. If your autonomic nervous system is not functioning properly, then you are going to have altered blood flow in the brain. And I'll talk about each of those kind of mechanisms. 2 is neuroinflammation, gut hormone issues. 3, visual and vestibular dysfunction. Visual dysfunction can drive some cognitive type symptoms and brain fogginess. A lot of the symptoms that people are describing are visual in nature, right? And so, yeah. 4, neck dysfunction. There's actually research to show that people with neck dysfunction and whiplash injuries, even without brain injury, have the same kind of cognitive dysfunction that people with concussion do. So everyone here is probably thinking that something's wrong with my brain because I can't think clearly or whatever, but it's related to so many other factors and not necessarily damage to the brain. One of them is neck dysfunction. And if you have neck dysfunction, that increases headaches, but it also increases dizziness and other somatic symptoms. And when you have increased symptoms, pain, whatever, it's going to impact your ability to think clearly. And then number 5, which I said is the kind of the biggest one, and that's where the most research is actually on kind of the mental health side, depression, anxiety, PTSD, stress, etc. So let's talk about mental health first, just because that is the kind of the big one. Now, there is a ton of evidence, and this isn't even all of it. This is just kind of a handful of studies that show that one of the biggest predictors of people going on to have persistent concussion symptoms is a pre-existing anxiety or depression. So if you've had anxiety in the past for any number of reasons, that increases your likelihood of having persistent concussion symptoms afterwards. And I'll just kind of highlight a few here, right? So here's a study in 2018. High school athletes with a family and personal history of kind of a psychiatric disorder, so anxiety, depression, etc., were 5 times more likely to develop PCS compared to people with no personal or family history of anxiety or depression. And here's an interesting one. Even those that never had a personal history of anxiety or depression, but had a family history of it, let's say you had a parent with anxiety or depression, they were 2.5 times more likely to develop PCS compared to those with no personal or family history. So if you have a personal history of anxiety or depression, and you have a family history of anxiety or depression, you're 5 times more likely to develop persistent symptoms than somebody who doesn't have either of those. But even if you didn't personally have a history of this, but a family member did, you're actually still 2.5 times more likely. So there's something here on the mental health side that can drive persistent symptoms. One of the most robust predictors of anxiety and mood disturbance and prolonged recovery from concussion is a pre-injury history of a mental health condition. Here's another one, 2020. Pre-existing anxiety disorders were associated with more severe symptomatology and prolonged recovery after concussion in children and adolescents. And here's a systematic review, which is, for those that don't know, a systematic review is kind of the top of the evidence pyramid, meaning they take all of the studies in a particular area and then they kind of put them together to say, what do we know based on all the research that we currently have? And this is the systematic review. Coping styles and pre-injury psychiatric disorders and mental health correlated with PCS burden and functional outcomes. Pre-injury factors with decreased risk of developing persistent symptoms include emotional resilience and adaptive coping styles. So it generally is saying here that poor coping styles or poor coping strategies, as well as a pre-existing history of, anxiety, depression, is more likely to lead to persistent symptoms. And I'm sure that resonates with a number of you. A number of you may be like upset hearing me say that, but this is just kind of where we're at in terms of this. Now, not only that, but if you never had a history of anxiety or depression, having persistent symptoms increases the risk of anxiety and depression. Obviously, if you are feeling like crap for a few months to a few years, you're going to be anxious about it. How could it not cause increased anxiety? How could it not cause increased depression, right? It just does. So here's another systematic review, large scale study. Experiencing persistent concussion symptoms increases the risk of experiencing symptoms of depression, just like I mentioned. Here's a one on 23,000 concussion injuries. 48% were subsequently diagnosed with a mental illness within 3 years. Majority of those were female. Here's the stats. Depression was 30%, anxiety was 37%, panic disorder was 6%, bipolar disorder was 11%, schizophrenia was 1.7%. So 50% increased risk of developing a mental health condition within 3 years of suffering a concussion. And that's over and above other types of injuries. So that's 50% increased risk just in concussion alone. Here's one from JAMA, large medical database. This is an Ontario study. So they had 153,000 concussion injuries, and they compared them to almost 300,000 orthopedic injuries. So meaning like ankle sprains and fractures and those types of things. All of them had no previous diagnosis of any mental health illness or issue prior to the injury. The concussion group then had a 40% increased risk of developing a mental health issue, self-harm, and psychiatric hospitalization compared to the orthopedic group. No increased risk for suicide, however. Now, this is something we actually see across the board from the media reporting and like all the CTE stuff. Basically, their narrative is that concussion and whatever increases suicide risk. Actually, the research shows that it's actually the same or lower in people with concussion or even CTE. You're actually less likely to commit suicide if you played in the NFL than if you didn't. So that's just a fact for you guys. So nocebo effects. Here's something I think that plays a big role in cognitive function after concussion injury. Oh, it looks like Nikki got booted. Looks like I'm in charge now. Um, so nocebo effects are essentially ill effects from kind of thought processes, but you've heard of placebo. So a placebo is something that you get a positive benefit out of something that doesn't have any actual benefit at all. So if we're going to run a drug trial, we would have one group would get the actual drug. So let's say we're trying to test a new blood pressure lowering medication. We would split the groups in half and we wouldn't tell you which group you're in. And because of that, you're blinded. And generally, the examiners are also blinded. They don't know which group people are in because it'll influence the results if they do. And they'll give the treatment group, they'll give them the medication. And then the placebo group, they'll give them just like a sugar pill, something that doesn't do anything. There's no therapeutic benefit, but they just want to see, what will happen. Does the drug actually work or is it placebo? So they'll have these two groups, and both groups will get the same info sheet about the drug. So it'll say the drug can do this, it can lower blood pressure, whatever. But here's the side effects. And so what you'll see in these drug trials is that people in the placebo group who aren't even getting the blood pressure lowering medication will actually experience a drop in blood pressure because that's how powerful your mind is. It can basically cause physiologic symptoms to go away because you believe you're in the treatment group. And a lot of times people in the drug trials actually believe they're in the treatment group, even though they're not. They're getting the placebo pill that doesn't do anything, but they'll experience a lowering of blood pressure. Now, so that's a placebo. A nocebo is that similarly, people in that control group that aren't getting the actual medication will start to experience the side effects that are listed on that sheet. They'll start complaining of like stomach upset. They'll start complaining of, sleep dysregulation. They'll start complaining of fatigue or a whole bunch of other things, even though they're not actually taking that drug. Because that's the nocebo effect, where you're actually experiencing the negative side effects of that. So misinformation that's out there around concussion, then you might have heard it. You may have gone to doctors and neurologists and etc. And they've told you things like, well, there is no treatment for concussion. Sorry, there's nothing we can do. Or, after 3 years, that's it. That's your new normal. That's as good as it's going to get. So I'm sure a number of you probably heard things like that, right? And that is going to sit in your mind and think, well, that's it. There's no way out. This is my new normal. And, I just got to get used to it. That's a nocebo. It's actually not true, but it lives in your mind. The media does the same thing. So listening to media reports, seeing reports about, CTE starts to get people concerned that, hey, I might have this because I'm experiencing some of these symptoms. And I think that does a big disservice for people in this community because you start to internalize that and it actually screws a whole bunch of things up. So the nocebo effect refers to new or worsening symptoms that develop in response to a negative health-related information, beliefs, and or experiences. So despite advancements in concussion research that shows that concussion is a treatable entity, and it's not due to brain damage, but it's due to all of these other factors which are treatable. Despite all of that knowledge, most doctors don't know that. And so they continue to use the same kind of things that they hear in the media and tell that to you, right? Oh, concussion? Yeah, I think you're supposed to sit in a dark room and you're not supposed to do anything. You're supposed to take 2 weeks off work. And they give you the wrong information because they're not aware, because they're not reading the actual research and they're not keeping up to date with it, right? Now, that's not necessarily a knock because there's a whole bunch of stuff that they have to try and keep up with, and concussion is kind of lower on the list for them potentially. But a lot of people get the wrong information and they end up developing chronic disability because of that wrong information. So placebo versus nocebo, we kind of talked about it. Placebo, you get the benefits of treatment. Nocebo, you actually receive kind of the negative benefits of, the side effects potentially that are unrelated. So the example I used was the drug trials. And another one here is if we think, and we've heard from others, from the media, from our doctor, that concussion impacts our cognitive function, what's going to happen to us? We are going to start to notice cognitive difficulties, even if they're not necessarily present, right? If I'm talking to somebody and I'm like, oh yeah, what's that guy's name? Oh, geez, the tall guy with the mustache or whatever. And, I just can't think of the name. I will just move on with my life after that because I'm like, sometimes I'm bad with names. But somebody with a concussion may take that as, oh my God, my mind, I can't think straight. I can't remember names. I can't pull up words that I want to use, right? This happens all the time in normal life. It's a normal part of life for, most people. And yet when you have a concussion, you then start to see that as a sign that something is wrong. And then it comes back to, well, concussion impacts my cognitive function. Something's wrong with my brain. And then you start to notice it everywhere, right? Can't find your keys. Can't, where did I put this thing? I'm looking for this document. I don't know where I put it. And then you start to think it's just getting worse and worse and worse. So you just find evidence of it everywhere. And I think that's what I'm trying to kind of help you with here is that that's not necessarily cognitive dysfunction. Here's another one. This one's on CTE, right? So CTE, study on former NHL players and concussions yields surprising results. In a new study by Toronto researchers, ex-NHL players showed no significant cognitive impairment regardless of how many concussions they'd suffered. But the findings don't match how some players say they feel, right? Because right now the narrative is that CTE leads to cognitive dysfunction and it's because of concussions. And so then every player who has a history of concussions will start to say, oh my God, maybe I have this. And then they'll start to notice little things. And then that'll start to reaffirm that, yes, I do have this. And then that will send them into a spiral, which will increase anxiety, which then impacts cognitive function because they're feeling anxious about it. And then they just spiral and spiral and spiral and spiral and spiral. And now they're in this state of rumination in the belief that I have something wrong with me. Even though they don't, they think they do to the point where it actually starts to manifest and it impacts their ability to actually think clearly. So this is called functional cognitive disorder. So, and this is like well studied in the concussion literature, is that many concussion patients report cognitive problems. Yet when we test them on cognitive function, they test normal. So many people with concussion, and I've talked about this with various neuropsychologists. What a neuropsychologist does essentially is they test cognitive function. They'll put you through a whole battery of tests. You'll sit there for 2 hours, putting pegs in a board and drawing shapes and word memory and all sorts of different tests. And when I talk to the neuropsychologists, they say concussion PCS patients, they generally will test completely cognitively normal, despite complaining of cognitive symptoms. So this is functional cognitive disorder is subjective cognitive complaints that do not line up with objective cognitive performance. So this is a somatoform spectrum disorder, which is in the family of conversion disorders. So a conversion disorder is where people will start to manifest physical symptoms that are not organic in nature, meaning that if you had a neurological problem, there's a certain set of signs and symptoms that would go along with that neurological problem. So if I was going to do a neurological screen on you because you were complaining of, numbness or weakness in your arm or something like that, or you're having trouble walking, and you were to do a neurological screen on somebody, there's a certain pattern of things that would appear based on, where that deficit is. Somebody with a conversion disorder will not represent that pattern. They'll have all sorts of weird, abnormal things that don't actually fit with a neurological problem. So that's called a conversion disorder. And that's due to just like extreme kind of mental health, right? So once you have extreme anxiety, extreme stress, it can start to manifest as these weird physical symptoms where your gait pattern starts to get all weird. I saw a patient years ago. She was referred to me by one of our other clinics in our network. And he's like, she's got all sorts of weird neurological stuff. Like, you got to take a look at this. So she sends her to me. And I go to get her from the waiting room. And she stands up and she's dragging her foot. She can't walk normally. So her one foot is just dragging on the ground. She can't walk. I start doing my assessment. And I'd be like, touch my finger, touch my nose. So that's just a cerebellar test to see if there's good cerebellar function. So I say, touch my finger, touch your nose, back and forth as quick as you can. And what you're looking for is if there's any abnormality where she's jerky in her movement or she misses my finger or misses her own nose, that's kind of a cerebellar thing. So she comes up, she's all jerky, she misses my finger. She comes back, she pokes herself in the eye, comes back, and so she's displaying signs of kind of cerebellar dysfunction. And anytime I tried to test her on something where she knew it was a test, she would show these drastic abnormalities. But yet when I said, "Hey, can you just hold this for me for a second?" she would reach out and grab it, no problem. So it was almost like when it was an assessment, she would display all these crazy symptoms, but when she didn't know I was testing her on anything, she would just do it normally. Right? Now, this is not intentional. She wasn't trying to do this. This is just something where there's so much stress in the body that you start to display these abnormal patterns. So anyway, I referred her to somebody who specializes in conversion disorder, and lo and behold, that was the case. Functional cognitive disorder is the same thing, where you start to kind of manifest these cognitive symptoms, even though there's no real kind of objective evidence that a cognitive disorder exists. So here's some studies on this. So here's 2014 Amadero. Patients were grouped based on self-reported memory deficits, either none to mild or moderate to high. So that's how they grouped them. They separated them by that. Then they were tested on various neuropsychological tests, and there were no differences between those groups. So those that reported very minimal cognitive dysfunction and those that reported very high cognitive dysfunction, the test results were the same between those two groups. So no real cognitive dysfunction. Here's another one in neuropsychology. 135 patients with concussion completed symptom scores and cognitive tests at 2 weeks and 3 months after injury. They found improvements over 2 weeks to 3 months from test 1 to test 2 in cognitive symptoms, but it didn't improve their actual cognitive scores. So even though many of them started to feel better cognitively, their scores remained relatively the same. And those improvements in their self-reported cognitive function was more related to improvements in emotional and somatic symptoms. So somatic symptoms are like physical symptoms, like dizziness, headaches, those types of things. So when their other symptoms got better, they self-reported that their cognitive function was improving, even though there was actually no change in their cognitive function from the start to the finish. So these findings indicate that improvements in subjective cognitive symptoms after concussion co-occur with improvements in other subjective metrics, but are not related to improvements in objectively measured cognitive function. All right. I hope that makes sense. I don't know if I'm explaining that well. This one here, 52 concussions versus 57 healthy controls. The concussion group had significantly higher levels of self-reported cognitive function symptoms, which we would expect. And for the concussion group, however, there was no correlation between any measures of cognitive complaint and any measure of objective cognitive functioning. So they're reporting cognitive issues, but yet they don't have any. This one here, again, this kind of neuropsych journal, 39 concussions versus 28 healthy controls. Concussion reported more functional memory symptoms. However, there was no significant association between objective memory performance and memory symptoms. Within the concussion group, the variable most associated with cognitive symptoms were depression, memory perfectionism, and rumination, which is anxiety, where your kind of mind is just spinning in, these kind of negative thought patterns. So here's how this happens. This is the confirmation bias. So we have media and kind of wives' tales, right? Concussion, you're supposed to rest your brain. You're supposed to, sit in a dark room. You're not supposed to do anything that causes any type of brain activity. Take 2 weeks off work, take a month off work. These are all wives' tales. The evidence shows that this actually makes you worse over time. Now, this gets portrayed to patients in the public, right? You've probably had friends like, "Oh, you got a concussion? Oh, you should just rest," because that's what they've heard. Right? You go to your doctor. Doctor doesn't know anything about concussion. They go, "Yeah, I think you're supposed to rest. So I'm going to put you in the dark room and don't use your brain and don't do anything." Right? So that's incorrect information that's being portrayed by, your peer group, but also untrained doctors. This causes a nocebo effect where you think, okay, something's wrong with me. This causes fear avoidance, where we actually stop doing cognitive activity. We get anxious about any type of thing that might increase our symptoms at all, so we avoid it. That just makes things worse over time. We also start to develop depression, anxiety, because we can't go to work, right? We can't exercise, we can't hang out with our friends, we can't do anything, we have to avoid stimulation, and we're isolated. This increases our anxiety and depression. So guess what's going to happen? You're going to get worse. And then, because you got worse, you go back to tell your friends, like, "Oh yeah, I'm still dealing with this." And they're like, "Oh yeah, concussions, they do that." And then the cycle continues. And then you go back to your doctor and your doctor says, "Yeah, concussions, they do that." And then now the cycle just continues and things just get worse and worse and worse and worse and worse, right? And then that also gets perpetuated by, "Oh, a friend of mine had a concussion and they were, out for 3 years. They're telling the next person with a concussion that, and now they're starting to internalize that and they're starting to feel that concussions can last forever and there's no real treatment for it. So this is kind of the cycle that's going on right now, and the one that we're actively trying to break with this program to tell you and give you the correct information to help you kind of realize that there's nothing wrong with the brain and we are able to get through this, and get on with it. Okay, so default mode interference. This is the last one, I think, on the psych kind of side. There's two main brain networks, right? You have your executive network, which is your when you're thinking, right? When you're just kind of in, like, call it also flow state. When you're just in the zone, you're doing things, you're not thinking about anything else. You're just like able to just perform. You're able to do, you're able to function at work. You're able to maybe play a sport. You're not thinking about anything else. And then you have your default mode network. This is kind of the little internal dialogue in your head. This is kind of your daydream, right? When you're just kind of thinking about random things. Oh, I got to do that later. And oh shit, did I forget to do that? And you're just, your own internal dialogue in your mind. This is also called the ego. It's our kind of sense of self, right? Our little voice inside the head. Now, normally these two networks work like a teeter-totter. So when one is on, the other's kind of off. So when we're really in a flow state, we're not having that little daydream kind of voice inside our head. When we're doing a problem and we're really dialed in on it, we're not thinking about anything else. We're right there. That's our executive network. And then when that shuts off, our default mode kicks in. So that's kind of, they call it default because that's generally where we're at, is just that little internal dialogue. Now, what we see in concussion, when we do fMRI scans and we look at brain networks, we see that both networks are activated at the same time. So if we give you a task, right? So there's a functional MRI where it's task-based. So they'll give you a kind of like auditory, sounds where you have to kind of click a button if you've heard the word before. They give you these little cognitive tasks to do inside the MRI machine to see which networks of the brain are active. And what you'll see in PCS cases is that a lot of times both networks are active. So you're trying to perform a cognitive task and your executive network is active trying to make that happen. But then also that little voice is chiming in, at the same time. So that's called default mode interference. So not only does your cognitive performance suffer because both of these networks are active and the default mode network is causing distraction while you're trying to do something, which is going to impact how well you perform on that task, but also it's going to burn a lot of energy because you have activation of both brain networks and your brain is obviously very energy demanding. And if you're activating both areas of the brain at the same time, you're going to have this kind of, drop in energy. So a lot of times people experience extreme cognitive fatigue where they just get burned out by trying to do any type of cognitive task. And I'm sure many of you have probably experienced that. And that is due to this default mode interference where you're not able to focus well because the little voice keeps chiming in and you can't pay attention to what's going on, right? If you think about a conversation, you're in a conversation, there's a group of people around you, you're standing there, you're in this conversation, and they're talking, but after a few minutes, you start just kind of thinking about other things, and now you're not focused on the conversation. And then in your mind, you start thinking, oh my God, I can't pay attention to this anymore. This concussion, it just keeps causing these issues, and I can't think straight. So in your mind, you're ruminating. That's called rumination, where your mind is just spinning in this other thing. Meanwhile, all the stuff that's happening around you, you're not actually focused on. You're focused on what's going on inside the internal dialogue. And then you leave that conversation thinking like, oh, I got to sit down. This is too much. I'm because both networks are active at the same time trying to do all this work, and you're just going to get burned out from that. Okay. So that's what happens in PCS. But what we also see is the exact same thing in people with generalized anxiety disorders. Because they're ruminating, their mind is just spinning because they just have this generalized anxiety. That happens the same way. Same thing with increased stress. So if we have a lot of stress going on in our lives, it's going to cause this default mode interference. We won't be able to focus on tasks. We'll get cognitively drained. We'll need to take a nap, all these types of things, and also PTSD. So when you see this in PCS, knowing the overlap between persistent concussion symptoms and increased anxiety, increased stress, and PTSD. Now, how do we treat this? Well, the way to treat this is actually to try and calm the mind, right? That's why we put Melinda's sections first, because it's all about trying to calm down the mind, which helps to balance our autonomic nervous system and actually helps us to start thinking more clearly. Because if we can reduce that anxiety response, we can now get our brain back into default mode versus executive network, and they can balance out better. Because we don't want to have them both on at the same time, because that's just going to drain us. So that's more of like a mental health side of things. But a lot of people will dismiss that and say, no, 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 that's not the case. There's something wrong with my brain. There's something going on inside, and that just keeps it alive. So we really want to make sure we're taking that part very seriously and doing what we can to kind of reduce that. So let's talk now about the next one, which is autonomic dysregulation. A lot of you will be familiar with this, but basically our autonomic nervous system has two sides. We have the parasympathetic side, which is our rest and digest, and then we have the sympathetic side, which is our fight or flight. This changes all sorts of, this is the signals to our organs, to our eyes, to our breathing rate, to our heart rate, to our ability to sleep, to our ability to have, sexual function. It's all related to the autonomic responses, and also brain blood flow. So when we're in a rested state, our pupils are able to constrict, so we let less light in. When we're in a sympathetic state, our pupils dilate, which means we let more light in. So for those people that are like light sensitive and noise sensitive and just overstimulated, you are likely stuck in sympathetic dominance. Your pupils are dilated, so you're letting more light in, more light than you need, and it's going to look bright and it's going to be uncomfortable. Same thing with sound, right? So this is a teeter-totter, just like the default mode. When one turns on, the other turns off. And if they're both kind of on, well, they can't be both on, but if one of them is going to be on, it's usually the sympathetic. And we get stuck into sympathetic kind of fight or flight, which means we're not able to sleep properly. We're not getting proper blood flow to the brain. We're having pupil dilation. We're letting more sound in. We're getting noise sensitive and light sensitive and all these other things. But it's going to impact our brain blood flow and our ability to think clearly. So blood flow impairments, digestive issues, increased anxiety and stress. And if we have increased anxiety and stress, what's going to happen? We're going to get default mode interference. We're going to get rumination. We're not going to be able to think clearly, et cetera, et cetera. Sleep problems, which means we're not going to be able to, get good, proper sleep, which means we're going to feel foggy the next day, which means we're not going to also clear inflammation during our sleep, which is going to make things even worse. So you can see how these all kind of fit together into this kind of puzzle that we got to try and untangle. Hormone imbalances, and then on that list is cognitive problems. So your autonomic nervous system controls blood flow to your brain. We've already talked about that. There's kind of 4 mechanisms that control this. I'll talk about each one of them. So cerebral autoregulation is our blood pressure. So our brain likes to have things consistent. Our brain likes to get the same amount of blood flow and the same amount of oxygen no matter what we're doing. So our blood pressure will change in our body. Cerebral autoregulation is how the brain blood vessels respond to those changes. So if blood pressure drops in your body, it has to try and increase the pressure in your brain so that it stays stable. So that's the mechanism that does that. Cerebrovascular reactivity, this is how the blood vessels respond to changes in CO2 in your blood. CO2 levels in your blood are primarily related to your breathing rate, right? A lot of times what we see in concussion patients is that their breathing becomes shallow and quick. So they're chest breathing rather than diaphragm breathing. So what's one of the things that we do, right? Deep diaphragmatic breathing. Why do we do that? Well, the diaphragm activates the vagus nerve. The vagus nerve is our parasympathetic nervous system. So that does 2 things. By activating the vagus nerve, we increase our parasympathetic function, which lowers our sympathetic function, which means that we're trying to lower that sympathetic function. We're getting ourselves out of fight or flight, right? When people are stressed, what do? Right? Deep breath in, breathe all the way out, right? You want to activate the diaphragm. Activating the diaphragm also allows more oxygen in. If you have a nice deep diaphragmatic breathing pattern, you're getting more oxygen into your body, which is going to change the CO2 levels, which is going to improve blood flow to the brain. So that's another reason why we want to do that. Neurovascular coupling. This is how our brain shunts blood to areas of the brain that are active. So just like our muscles, if we're exercising a certain muscle, the blood vessels to that muscle will dilate to let the blood go there to let us do the work we need to do. And by doing that, it'll constrict blood where it's not needed, right? So generally, if we were exercising, blood from our organs is pulled away and it's sent to the muscles to do the work they need to do. When we're not exercising, the blood vessels will then constrict in the muscles and push blood to the organs. Same thing happens in the brain. If a certain area of our brain is active, the blood will dilate, blood vessels will dilate to push blood there, and it'll constrict where we don't need it as much for that particular task. This is controlled by the autonomic nervous system. And if we have autonomic dysregulation, we see dysfunction in this, where we're not getting the right blood flow to the right areas. And so obviously that's going to impair our ability to think properly. And then cardioautonomic is heart rate variability. So your heart rate is constantly kind of fluctuating depending on the tasks at hand. Like if you take a deep breath in, you'll notice your heart rate will speed up. And as you breathe out, your heart rate will slow down. That's just how it works. And this is also controlled by your autonomic nervous system. So if you're stuck in a high sympathetic state, this heart rate variability drops. You're not getting that variation in blood flow. So autonomic dysregulation causes poor blood flow, which obviously reduces cognitive function. It also leads to exercise intolerance, reduced digestive motility and gut issues, which is then going to cause inflammation. Sleep dysregulation, because if you're stuck in fight or flight, you can't sleep as well. So you're going to have reduced energy, you're going to have reduced cognitive capacity, and you're also going to have increased inflammation. It's going to cause hormone imbalances like cortisol and all these other things, which are tied to poor sleep function. And also, obviously, then downstream effects, cognitive function, and everything else. And then anxiety also then leads to autonomic dysregulation. So everything's so connected. Next up is neuroinflammation. So inflammation alone is tied to cognitive function, neurodegenerative diseases, fatigue, energy levels, headaches, mental health, etc. And this is a lot to do with the gut-brain axis, which again, like I said, is the vagus nerve, which is activated by the diaphragm and some other things. So injury happens, microglia, which is our kind of inflammatory cells in our brain, get primed. Vagus nerve, right, affects our gut. Dysautonomia causes damage to the gut mucosa. So we get a change in bacterial composition of our gut, which causes inflammation, which causes a release of inflammatory cytokines, which then causes issues with the brain and cognitive function. We get neuroinflammation, cognitive impairment, mood changes, all kind of related to this cycle. So that's where diet becomes important for affecting cognitive function. We see increased gut permeability in as little as 3 hours after concussion. We see increased gut dysbiosis in as little as 3 hours post-concussion, and that's associated with brain blood flow. So this could be implicated by food sensitivities, digestive issues, low energy, reduced cognitive processing, anxiety, and depression. Now let's talk about sleep. Sleep, as I mentioned before, helps you clear inflammation from the brain. And here's kind of the cycle, right? We have anxiety. That's going to cause autonomic dysregulation. That's going to alter our sleep pattern. That's going to increase inflammation. It's going to lead to poor cognitive function. And guess what? That's going to increase our anxiety because of our poor cognitive function, which is then going to go through this cycle again. And here's your kind of spiral downwards, 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 downwards. Right? So we need to kind of put a stop. Where can we put a stop? Well, we can help with anxiety. We can regulate the nervous system, which helps with sleep. And there we go. Neck dysfunction. I mentioned even things like neck dysfunction, right? So this study here found reduced cognitive function and postural control balance in whiplash patients. Chronic whiplash patients displayed significant cognitive and emotional symptoms. Here's one here. Concussion patients perform the same as whiplash patients on cognitive testing, measurements of attention, memory, visual spatial awareness, and executive function. Neck dysfunction also increases due to anxiety. So if you have anxiety, you hold tension. A lot of people hold tension in their necks, which is then going to cause neck dysfunction and all the other kind of cognitive issues, headaches, and everything that goes with it. So here's kind of the crazy interconnected. I did this on a slide, and this is as clear as I could make it. If anyone has a better idea of how I could make this a better diagram, then please tell me. So we have concussion. Concussion we know increases anxiety. We also know it increases autonomic dysregulation. Autonomic dysregulation increases anxiety, and anxiety increases autonomic dysregulation. They go kind of hand in hand. Then from autonomic dysregulation, we get blood flow impairments to the brain, we get gut issues, we get sleep issues, we get sensitivities to light, sound, noise, whatever, and we also get increased neck dysfunction. Then from there, blood flow impairments alone will cause changes in cognitive function. Gut issues will cause hormone dysfunction. Sleep issues will cause hormone dysfunction. Gut issues will also cause inflammation, and sleep issues will cause inflammation. And then all of these sensitivities and everything, right? If you're sensitive to light and noise, it's going to impact your cognitive function. Neck dysfunction impacts that. Medications impact that. And then cognitive function difficulties increase our anxiety, and the whole kind of cycle continues. So everything is so interrelated, right? If we're going after cognitive function, a lot of times people will just be prescribed cognitive rehab. And that's the typical thing, right? If you go to a concussion clinic, they're like, oh, cognitive symptoms. Okay, we're going to send you to cognitive rehab. I think that's missing the point completely because cognitive function is tied to all these other things, right? What about your autonomic function? What about your diet, your nutrition, your gut? What about your sleep? What about all these other factors? So our thinking around things like brain fog and other cognitive processing difficulties is not to try and treat the cognitive function. We fix all the other factors, and then the cognitive function basically takes care of itself. And if it doesn't, then we can start doing further investigation to figure out, is there something else going on? Is there actually cognitive impairment here? Let's get tested. Let's start doing some rehabilitation. So how do we fix it, right? Well, this is the concussion fix pyramid. This is how we operate. So first we want to understand PCS, right? Once we can understand PCS, that our brain is not actually damaged and it's just these dysfunctions which are treatable, that will reduce our anxiety a bit. Okay, then we can move on to recovery mindset, right? Trying to reduce our anxiety. And the anxiety will help with cognitive function. It'll also help with sleep. It'll also help with regulating the nervous system. Then we get into regulating the nervous system. Then we start optimizing our sleep. Then we start addressing neuroinflammation. Then we start looking at our diet, balancing hormones. Then we start getting into exercise, which is going to balance our autonomic nervous system. Then we treat our neck, right? So you can see this is the process. We want to get rid of all of these other factors first. And the majority of the time, cognitive function will improve all on its own just by fixing all these other dysfunctions that cause the cognitive dysfunction to begin with. Remember this, right? So all of those things we're talking about are basically treated in this program. So that's how we do it. And then once all those potential causes are addressed properly, cognitive problems will most likely resolve. Now, if they don't, and this is what we cover in the cognitive function module, if you've done all those things and you don't have any more symptoms, you're not getting headaches anymore, you're not feeling dizzy, but you still feel like there's some cognitive issues, and that's it. That's the only lingering effect. Well, now we actually want to investigate that. Now we can go to a neuropsychologist and see, is there something actually there? So you go through the whole battery of tests and they'll tell you if there's a deficit or not. And if there is no deficit, then you can attribute that to being like, okay, this is just me thinking that something's wrong when actually it's not. Or they'll say, yeah, there's a deficit here and here. And now you can actually start to do rehab for those particular areas. And because you've built that strong foundation, that rehab will actually be much more effective than trying to do rehab when you have all these other symptoms and then it just clouds the whole picture. Now, another option for those that are interested or they want to start kind of doing some cognitive stuff early, we have a partnership with NeuroTracker now, and I'll post the link in the chat here in a second. But basically, the NeuroTracker, I'll show you this video. We've included it in our new kind of program. But this is a great tool. I've used it in my clinic forever. And basically what it'll do, you'll see like it'll highlight these balls. So this is a 3D kind of thing. So it'll highlight these balls. And then once those balls start moving, so it'll unhighlight them. So you're supposed to track this one and this one. So just watch these two balls. Everyone try to do this. Watch those two orange balls there. So that'll go away and they'll start moving. So you just got to keep your eyes on those two balls. Okay? What numbers? Right? 3 and 4 is what I got. So then you click on them, 3 and 4. And then if you're correct, it'll get harder. Now this is really hard because it's 4 balls and they're going super fast. I can't do this at all. So don't feel bad if you can't, like I've already lost it. But this is kind of at the top level. So what you do with this is you start really slow like that and you're like, hey, this one and this one, and then it'll gradually increase the speed a little bit, this one and this one. So this helps you with things like working memory, spatial awareness, your attention, your ability to focus on numerous things at the same time, executive function, alertness, processing speed, peripheral vision. So they have a free kind of brain assessment, and the link is, where do I have it here? I have it somewhere. Hold on. No, that's not it. Where did I put it? Oh, here it is. So I'll put it in the chat, and you guys can go there when you want. And you can take a free brain assessment. And then they also have kind of like a rehab program if you want to follow it. There is a cost to it, but we get a reduced rate. I think you guys save like 10 or 15 or 20% or something like that on it because you're um, a CFix member. But anyway, that's another option for you if you want to start in with some sort of kind of cognitive functioning stuff just to try and work on some things, because I think it translates to a lot of other factors. So that's essentially it. And I'll open it up for any questions that people might have. And yeah, we'll go from there.